everyone, good morning. I'm Theresa Alota from Bachelor of Science in Nursing Section 1A6, and today I will be conducting assessment for cardiovascular system. So cardiovascular system is the system that is responsible for the transportation of nutrients, blood, oxygen, carbon dioxide, hormones, and other substances to and from the cells and the organs of the body. It is very important since it helps the body meet the demands for activity, exercise, and stress. So for today's demonstration, my patient is my sister, Christine Marie P. Alota, and since she is a minor, I got the consent of my mother and father that I will be using her as my patient for today. And also, as for the procedure, I already instruct her what are the things that she must do as I perform the procedure. Prior to the conduct of the procedure, first we must prepare the necessary equipment for this assessment to conserve time and energy. So here I have the patient's record to check the health history of our patient. Then we have a stethoscope for auscultation, sterile gloves, a hand sanitizer to prevent ourselves from cross-contamination of infection, a pen light for visualization, and a centimeter ruler. But before we delve into the actual physical examination for cardiovascular system, first let us review the patient's record to check for the previous conditions such as heart disease or any other condition that may related to cardiovascular system. So if there are any conditions, please utilize the old CART mnemonic follow-up question. So old CART stands for the onset, the location, the duration, the characteristic of the symptoms, the associated manifestation, the relieving factors, and the treatment for that condition. So it is utilized to obtain a full description for the description. So since my patient doesn't have any previous record, since it is her first time, I will now proceed to the physical examination. So hello ma'am, good morning. I am Theresa P. Alota, your student nurse for today, and I am from Southwestern University, FENMA. So may I have your wristband, ma'am? Kindly state your name.
My name is Christine Marie Alota.
Okay, your birthday?
December 27, 2006.
Okay, thank you ma'am. So right now ma'am, I'm going to assess your cardiovascular system. So it means I'm going to check your pulse in the neck, your arteries on the neck, as well as the heart sounds that produced by your heart. So is that clear to you, or you have any question?
No.
Okay. So right after explaining the procedure to the patient, perform proper hand hygiene. Then observe privacy to the patient. Okay, the very first thing that we should do is to place the patient in the supine position with head elevated 15 to 30 degrees. And then assess for the comfort of the patient. So make sure that the neck part is aligned on the plane, and then we can now start the physical examination. Next, inspect the carotid arteries of the patient. So make sure to inspect the carotid arteries individually and do not inspect them bilaterally, because palpation of the carotid arteries bilaterally can cause or can reduce cerebral flow. Okay, right now ma'am, I'm going to inspect and palpate your carotid arteries. Is that okay?
Yes.
Okay, can you please move your head on this side? Okay, on the other side. So feel the amplitude for stroke and thrills. Okay, the next thing that we should do is to auscultate the carotid arteries using the bell of the stethoscope. So listen for a brewy sound. A brewy sound is a blowing or swishing sound that is produced by a turbulent blood flow from a narrow vessel, which is an indicative of occlusive arterial disease. Okay, ma'am. So right now I'm going to auscultate your carotid arteries. Okay, let's start from this area. Okay, to the other area. So far, I don't hear any brewy sound. Next, we need to check and inspect for jugular venous distension. So, place the head of the patient away from the examined area. So, I'm going to on the other side now. Okay, so if jugular venous distension is noted, we must proceed to assessing the jugular venous pressure. So far, my patient has no jugular venous distension. Okay, proceeding now to the general inspection of the precordium. So I am now looking to any pulsation and symmetry of the chest area. And also, I'm looking for a retraction or hips, which is a strong outward thrust of the chest, but I don't see anything, which is good. And then, let's proceed to the palpation of the precordium or the landmarks for the pulsation. So we need to use the palmar surface of our hand to palpate the 4 landmarks, so which is the aortic area, the pulmonary area, the Erb's point, the tricuspid area, and the mitral area. So right now, ma'am, I'm going to palpate your precordium. So I'm going to start with the aortic area. That is found in the second intercostal space, and then to the pulmonary area. Okay, so and the Erb's point, and to the tricuspid, which is located on the fourth intercostal space. And then on the mitral area or the apical area, which is located in the mid-clavicular fifth intercostal space. Okay, so far I can feel the heartbeat sound. After the palpation of the cardiac landmarks for pulsation, we must take note for the force, the size, the location, and the duration of the pulsation. And 4, 3, 2, start. So after palpating the cardiac landmarks, which is the aortic, pulmonary, the tricuspid, the Erb's point, and the mitral valve area, we must take note for the size, the duration, the location, and the force in relationship to the mid-clavicular. And next, we're going to auscultate the same And next, we need to auscultate the same landmark that we felt the pulsation a while ago. So I'm using my stethoscope. So use the diaphragm to hear the heartbeat. Okay, right now, ma'am, I'm going to auscultate the cardiac landmarks for pulsations to check your heartbeat. And I want you to breathe normally, okay? So, pulmonary area. Then down to the Erb's point. And to the tricuspid valve. And Okay, so far I only hear normal heartbeat sounds. So there is no present of S3 and S4 sound. So I am now done assessing the cardiovascular system of the patient. So I will now bid my goodbyes. So we are now done with the cardiovascular system assessment, ma'am. Thank you for your time and for your effort.
Thank you.
So if you have any concern, please don't hesitate to press that call button so that we can assist you right away, okay? Okay. So make sure that the patient is comfortable, and then right after leaving the room, don't forget to document all the findings that you have gathered a while ago. Then perform proper hand hygiene.